Well, we've heard a lot over the last few years about stem cell therapy and its ability to be applied to various conditions, cerebral palsy, heart failure, MS, arthritis, and a number of other ailments. But there are still a lot of questions on how stem cells are collected and how they're implanted. Well, here to shed some light on that and the new developments is Dr. Pericles Lantz of the Spine and Joint Center of New Jersey. Thanks for coming on board and talking to us. Interesting development, and we should say first, these are adult stem cells you're working with and not the embryonic stem cells that raised so much controversy.
Absolutely. It's a relatively new concept that adults have stem cells. We've only really realized this for the last 5 years. So again, these are adult stem cells and they're your own cells, so you can't react to them because it's your own tissue, it's your own body. So
you're taking these cells, are you storing them first and then someone can come back to you and say, hey, I've got a wound or I've got an infection or I've got something that you can regenerate new cells?
You know, it's a great question. We have stem cells in every organ system in our body, but it's only really practical to get stem cells from two places. You can get stem cells from fat tissue and you can get stem cells from bone marrow tissue. Right now, the storage of stem cells is really for research purposes. Okay. In general, we're taking the stem cells and we're immediately using them to give back to the patient.
Okay. And what are the applications right now?
So the two main things we're doing is the stem cell facelift, and that's a cosmetic application. So we take stem cells from fat tissue and we inject it into the face, and what this does is it revitalizes the tissues of the face, adds vibrance to the skin. It helps create connective tissue, the structure of the face. So people end up with more volume, they end up with more elastic, more youthful skin. And the other application we use right now is injection of stem cells into joints. So for people who have very bad arthritis or they might have some missing cartilage, we're injecting stem cells into knees, into hip, into shoulders. Yeah.
That's incredible. It's almost like one thinks of a toad or a frog that loses a limb and it grows it back. Is that
we're getting there. That's really going to be the future. You know, I like to think of stem cells as soldiers. And we really need to learn how to talk to them. And the future is going to be that we really understand the messages that they need to hear, and we can give them their marching orders and tell them exactly what we need to do. Right now, we're relying on the stem cells to listen to the calls of the body. When there's an injury, if you had a paper cut, your body knows that that's a little wound, and it sends out a healing response. So that healing response calls out to these cells and helps to activate them.
So these would be kind of like a white blood cell response?
Sort of similar concept, but a stem cell, you have to remember, is a cell that has the ability to become other cells. So they are listening to similar calls. Okay. A white cell would be fighting an infection, but these cells are really helping to turn into other cells that are needed.
That is incredible science. What's the next step? I mean, you started in a couple of places here, but where do you see the big use of this?
I would love to see stem cell therapy be regularly applied to heart disease, which is a major, illness in our country, to neurological conditions, to people with diabetes, to help give them back the cells that they need to make the insulin, which, if you don't have it, causes diabetes. So those three areas are really where I'd like to see it go in the future.
Where is the major research taking place right now?
There are major centers across the country. In New York and California are big centers. But again, it's about the starting point, which is where we are now. And as we mature in this field, I think the next 5 years are going to be very exciting.
Wow, that's pretty fast.
Yeah.
That's pretty fast. Where are you seeing success right now? You talked about using it in the cartilage.
Right.
Has it worked?
Yeah. Oh, yeah, absolutely. Our patients are very happy. And again, back to the aesthetics, people are very, very happy with the results.
I would imagine a lot of plastic surgeons are going to be hating you guys.
Well,
you're growing back this.
We can't help where we're going. That's just the way it is.
Well, it's fascinating stuff, Doctor. Thanks for coming on and joining us.
It's a pleasure.
We're gonna keep our eyes on this because that's a huge development.
Yeah.
Thanks much.
Take care.